Parasite is an organism that lives on, in, or with another a host organism in order to both obtain its nutrient or food from at the expense of its host, often in a state that directly or indirectly harm the host. Actually, parasites are generally found inside the GI tract or over the body coats, and these parasites generally an organism live in the host due to its nutrient and food from the host, and they survive. And due to these parasites, main host, that means sheep and goat, are very affected due to these parasites. Last 20 to 30 years, we are depending on the anthelmintics to control the parasites. Yes, we know to control the parasite. Before controlling the parasite, we have to very cautious about the anthelmintic resistance. Nowadays, it is very emerging problem, and we should know the parasitic epidemiology and when which is changing due to the climatic variations nowadays. Next point is there is a new understanding of anthelmintic resistance and their control due to injudicious use of chemicals, that means anthelmintics, overdosing, underdosing, and incorrect use of anthelmintics. Nowadays, a resistance is developing. So we should very cautious to use the anthelmintics before drenching. And what types of parasite, what types of anthelmintics we have to use. Next, we know simply parasites are two types, internal and external. And internal parasites, cystodes or trematodes, nematodes, three types. And external parasites are lice, ticks, mans, etc. And parasitic life cycle is very much important to mitigate the control strategy. If we can break the life cycle, we can break the diseases also. So before giving the anthelmintics, we have to break the life cycle also. We should know about the intermediate host, dead host, like that. So to kill the immature parasites before they become adult to stop the damage. So before adult, we can, to some extent, we can kill the immature parasites also. And we have to practice the plan of rotation grazing. We know everybody is knowing that the rotational grazing, although it is very tough to maintain a rotational grazing, so we can also practice to control the parasitic life cycles through rotational grazing. And so we can control with this by breaking the life cycles also. We, as a whole, the common signs of parasitism. If an animal, sheep or goat, any animals is suffering from the parasitic diseases, the most common symptoms are loss of conditions, rough body coat. It is very true fact, and diarrhea to some cases, and bottlejaw in case of paramphistomesis and fasciolosis. It is very prominent sign, and pale mucous membrane in case of especially hemonchosis, because hemonchus is a blood sucker, and we know one hemonchus parasites suck blood 0.05 ml daily. But in an sheep and goat, I have seen numerous parasites, bundles of parasites in abomasum. So hemonchus causes the anemia, especially debility, rapid breathing due to the lack of, that means hemoglobin level when it is down, low hemoglobin level, in that cases rapid breathing will be occurs, tachycardia, and ultimately death. Different gastrointestinal parasite, we know everybody that fasciolosis, dactylium, emphistomesis, hemonchus contortus, Ostrorhizia, Varostomum, Trichodis, Coperia, Trichostrongylidis, Mecistroceras, Monasia, Cystosoma, etc. These are the common parasites. Now trematode. Among the trematode, fasciolosis or fasciula is commonly known as liver flu. It's damage the liver tissues, liver parenchyma. There are many species, Facilla hepatica, Facilla gigantica, and these are two very common fasciola species in sheep and goat. Intermediate host, we know the limniids and pond snails. That means pond snails are the intermediate host. Definitive host, we know everybody: pig, rodent, ruminants, and even human. And geographic distribution worldwide. This fasciola infection is found worldwide distribution. And we know that before controlling to some extent, we have to know about the fasciola life cycles. Life cycles are in two parts. Life cycles inside the final host, that means sheep and goat, and inside the snail. The adult host secretes its egg from through feces to miracidia larvae, sporocyst, and these stages are developed in the snail itself, and circuitry, even metacircuitry, and again in adult fasciola. This is also a life cycle, similar types of. And clinical signs and symptoms in fasciolosis: intermittent fever is there, abdominal pain, lethargy, loss of appetite, nausea, diarrhea, and hepatomegaly, splenomegaly, ascites, anemia, and jaundice is the typical signs. Anemia and jaundice are the typical signs, and bottle jaw. And pathogenic lesions. And if we see the postmortem in liver, in cholangitis, that means in liver, gallbladder itself, and in bile duct, fasciola is commonly seen. And these are the common pathological lesions are found. Fibrosis, biliary obstruction is there due to this fasciolosis, and degree of cholangitis, that means bile duct inflammation, and hemorrhage, enlargement of liver, fibrosis, liver in enlarged and hemorrhagic spot, hepatic bile duct enlargement, and these are the fatty cells also there, calcification also there, and pipe stem liver in bile duct. Some clay-like structure is found, that is also called is pipe stem liver. Diagnosis: we can diagnose through stool microscopy, concentration techniques, that means sedimentation techniques. We can easily diagnose. The fasciola egg are found in lightly yellowish color, and paramphistrum and fasciola are the same shape, but fasciola egg are the slightly straw color. That means yellowish pigmentation due to the bile ducts. And through other diagnostic techniques is there, but mainly is the fecal examination. So our field veterinarians should continuously, it should be routine practice to do the fecal sample before the any drug administration of the parasitic diseases. So we know the clinical symptoms after diagnosis, and we have to treat the causes, diseases. That means the drug of choice for the fasciolosis, triclabendazole. The dose rate is 10 milligram. Along with the triclabendazole, we have to give the liver supportive liver tonics and any other vitamins like that. And prevention. So we know that there is no vaccine against the fasciola infection. So we have to regular deworming on the basis of the fecal examination, and using the molluscicidal drug to control the snail. That means we have to control the snail mainly, because it is the intermediate host. Snail, if we can control the snail, we can control the fasciola also. Emphystomasis, we know it is found in the rumen. It is also flat worms. When And intermediate host is the Endoplasmic exostrus, Planorbis also, and final host are ruminant species, especially cattle, sheep, and goat. Common symptoms: foul smell of the feces. It's a very typical symptom of the amphistomasis. And anoxia, refuse to food, eat, thirsty, dull and depressed, abdominal pain, and submandibular edema. These are the main symptoms. And in blood examination, plasma protein, that means ALT, AST will be reduced. So causes of amphistomasis are the paramphistomum exi. These are the causes of the paramphistomasis. And final host, we know the cattle, sheep, goat, and natural host is pig and monkey. Life cycle, likewise fasciolosis, and this amphistomasis is also a same types of life cycle. So we have to control the snail population in the, because snail are the main intermediate host. Pathogenesis or pathological symptoms are, we know that hyperemia, hemorrhagic ulcers, dilatation of intestine, submandibular edema, sloughing of the intestinal wall, severe enteritis, and edema also may occur, anemia, weight loss, and cachectic condition also there. Diagnosis, history, and clinical symptoms. We can diagnose through clinical symptoms and followed by fecal examinations. And treatment, we should know the drug of choice. Likewise, fasciolosis is triclibendazole, and oxychloroquine is the main drug of choice for the amphistomasis, because we should use the proper anthelmintic. That means the drug of choice, specific drug we should use. Otherwise, the anthelmintics will not work. Along with the oxychloroquine, we have to give some other supportive treatment also, supportive drug therapy. Again, another disease is schistosomiasis. It is a very nowadays chronic problem in underdeveloping or South African country also, Bangladesh, Nepal, Nigeria, Ethiopia, Ghana, like that. In our country also is available in some areas, Schistosoma indicum, Spendeli, incognitum. These are the parasites mainly cause the Schistosoma indicum and snail-borne also disease, intermediate course of snail. So in human beings also, it is a causes of a zoonotic importance also, because some poor drainage who used to drink the field waters, that means drain water, pond waters, and who are frequently swimming in the fields, that means ponds or other water areas, water bodies, human also it can suffer, it affected from this schistosomiasis. And epidemiology, already I've told that it is also worldwide, especially in South African countries and underdeveloping countries. The who are bathing in the water containing in they can also infected from the Sarkadi. Area where human schistosomiasis is also includes, they are South African countries, sub-Saharan countries. Also, these are diseases also commonly found. The life cycles, we know that here also snail is the main culprit. That means intermediate host. So we can, if we can control the intermediate host, we can break down the diseases also. Signs and symptoms: acute schistosomiasis also, skin rashes, skin rash, skin some lesions will come in the skins, and muscle acne also occurs in chronic schistosomiasis, abdominal pain, enlarged liver, blood in stools, hematuria, liver fibrosis, seizures, paralysis, and spinal cord inflammations. Diagnosis: stool or urine samples examination. We can diagnose from through stools and through blood also. The schistosomiasis eggs is also known as Napoleon-shaped eggs, and these adult parasites contains two head, male and female, also exist in the same parasites. So in treatment, we can treat this diseases with praziquantel in cattle 40 milligram per kg body weight and human half dose, that means 20 milligram per kg body weight. Prevention, as we know that there is no vaccine, avoiding swimming or wading in the fresh water, swimming in the oceans and the chlorinated swimming pool in safe. That means chlorine containing swimming pools, it is very safe. Drink safe water. We should avoid the field water, that means pond water, because it have a very zoonotic importance. And control strategies, we have to control the reducing the number of infections, eliminating the snails, improve sanitation and regular deworming. Now it's cystodes. Cystodes is the another types of parasites. That Monasia expansa is the main parasites, and its kingdom is Animalia, and species is Monasia expansa. Sheep tapeworms are very dangerous because it's block the intestinal wall, so we cannot pass the food material through intestine. Sometimes intersusceptions also occur, so animals used to die suddenly. And here we have to we know that definitive host sheep, goat, cattle, and rarely pig. Intermediate host is oribitid bites. Next, we know I am giving the more emphasis on life cycle because we should avoid the regular use of anthelmintic because it is the main cause of the development of the anthelmintic resistance. So we should break down the life cycles. Common symptoms of monasiasis or Monasia expansa. It is very general, harmless, and asymptomatic. However, heavy infection may cause intestinal obstruction. Already I have told, because it is very long parasites, so it can obstruct the intestine. Diarrhea, weight loss, anemia, increased water content, reluctant in reduction in the protein and fats. Diagnosis and treatment. We can diagnose this through fecal examination. As I told, the routine fecal examination is a very must before the anthelmintics medications. And drug of choice, praziquantel, niclosamide, and main drug is the niclosamide is the most effective drugs, and praziquantel also. But we should not practice the albendazole, fenbendazole because these drugs are the very less efficacious. Nematode or roundworm. So Haemonchus contortus is the deadly parasite. This is the main culprit of the parasite for sheep and goat. It is a blood sucker parasite. An adult parasite daily suck 0.05 ml blood from his host. And I have seen tremendous parasites in abomasum, and it contains lump-like parasites. In northeastern region, I have told already that northeast regions is known as the parasite of parasite, a paradise of parasite, because northeastern regions exist, but it contains congenial environment to propagate or produce the parasitic diseases, because humidity is there, rainfall, temperature, these are the very convenient for this parasite. And Haemonchus contortus is also known as Barber's full worm. And Haemonchus parasite, on seeing the which one is male and which one is female, we can easily identify. These are the male parasites. And clinical symptoms, mainly deadly parasites. It causes the anemia severely, pallor, anemia, edema, ill thrift, lethargy, depression, retarded growth, decreased production, dark color faces due to the breakdown of the hemoglobin. So here we have seen these photographs, the pale mucous membrane due to the hemoncosis. Here is also life cycle. Adult Haemonchus parasites lay eggs, and these eggs comes out from the feces, and it is come in grazing land, and this develop L1, L2, L3. Again L3 ingested by the final host, and it's again come to the adult. So this way, these are the life cycles. Already I have told the life cycle should be controlled properly. And hemoncosis also cause the reduced feed intake finally, and disturb digestion and disturb general metabolism. After all, production losses due to the heavy loss of the blood. This is also a life cycle I have already discussed. Pathogenesis, pallor, general pallor of the carcass, ascites may also notice. Abomasal, mucous membrane, edematous and congested, and petechial hemorrhage in the abomasal wall. Pinpoint hemorrhage also there in abomasal mucous membrane. And in hemoncosis, eosinophil. In general, eosinophil percentage is high in case of parasitic diseases. Prevention. Prevention is the main thing. Here I have to discuss Famasa. Famasa is developed by a South African scientist, Haha Malan Sard, through which we can diagnose the degree of anemia. Why I am telling this, sir? And the South African scientist invented or this sard to avoid the injurious use of anthelmintics, because by coloring the mucous membrane, comparing the mucous membrane, we have to use the anthelmintics side by side, the fecal egg count also. See this sard. This sard is known as Famasa sard, color guide to the standard of anemia and range. Number 1, red, non-anemic. Number 2, red to pink, non-anemic. That means 1 and 2. In case of 1 and 2 grade, we should not use the anthelmintics. And from 3rd onward, 3rd means slightly anemic, mildly anemic. 4, pink to white, anemic, and 5, peppery white, severely anemic. So we can think of the anthelmintics from 3rd points onwards. And 1 and 2 we should avoid. And side by side, fecal egg count and hemoglobin, PCV percentage and hemoglobin, we can also correlate, so that we can reduce the anthelmintic resistance. If we use in the all cases frequently 2 months, 3 months like that, but it will develop the anthelmintic resistance. So this Famasa salt will help to reduce the spread of the anthelmintic resistance. That means 1 and 2 we have to avoid the drugs, and number 3rd and 4th, 5th we can use the anthelmintics. Likewise, coccidiosis also very common in sheep and goats. Coccidiosis is also through oral transmission, through waterborne disease. It's also, if we what I am telling the coccidiosis, sometimes we give the anthelmintic drugs, but it's not responding. In that case, we can think of about the coccidiosis. So we can use the drugs, suppose sulfur drugs, like that. So anthelmintic resistance. We know that nowadays resistance is frequently developing. Anthelmintic resistance is defined as a generally genetically transmitted loss of sensitivity of the drug in worm populations that were previously sensitive in the same drug. That means previously, suppose albendazole, fenbendazole were working. Nowadays, it is not working because we are frequently using the drugs. So, frequently using injudicious use of anthelmintics, underdosing, and overdosing, these are the factors to developing the anthelmintic resistance. So, we should stop the spread of the anthelmintic resistance also. AR can be diagnosed through in vivo, that means fecal egg count reduction test. That means 95 and above percentage is considered as a sensitive. That means below 95% it is considered as a resistance. And in vivo egg has assay. That means in laboratory we can dilute the pure chemicals of the anthelmintics, and we can that chemicals, through chemicals we can use to hatch the eggs, so that we can diagnose the whether it is drug resistance or a drug susceptible. So I have already discussed about the frequency of the treatment, rate or reinfection after dosing, overdosing, underdosing. These are the main cause of the anthelmintic resistance. And we have already discussed the new strategy, that means FAMASA. FAMASA is the only tools who can prevent the anthelmintic resistance. That means through FAMASA cert, we can control the frequent use of the anthelmintics. Here also parasitic control as a whole in general. Rotational grazing we have to practice. The test the anthelmintic and AR on your farm. That means frequently testing should be there in our farms, and administer anthelmintics efficacy effectively. That means anthelmintics should be administered effectively, and which drugs is very effective, that drug we have to use. And through fecal egg count monitoring, we can also practice the farms. That means without fecal egg count, that means fecal FECRT, we should not give the drugs. Regular monitoring is a very important management, management of the most important aspects of sheep and goat production applied to the following: nutrition, housing, environment, parasites, pathogens are the main causes. Now the time for importance of the deworming. We know deworming. What is the importance? Sheep and goat always have a low level of parasite activity in open grazing system. Generally, sheep and goats we are used to open grazing systems, and always low level parasitic load is there. Parasites are not ingested or naturally killed in the host by the host. Few parasites pose a significant threats to the health under stress or malnutrition. That means stress factor. In case of stress and malnutrition, animals generally suffer more by the parasitic diseases. Many parasites do considerable damage or even kill the host before their presence is known. Internal parasites are the first cause of illness and death. in case of sheep and goat. High susceptible, younger age group are the high susceptible, and stress, that means malnutritious, that means malnutrition or low protein protein content containing animals are the main susceptible animals. And less susceptible is adult and healthy. We should know the healthy animals are the less susceptible host animals. Here, sheep is known as museum parasite. I have told that northeastern region is the paradise of parasite. That likewise, sheep and goat are the museum of parasites. That means the sheep and goat are highest susceptible animals among the livestock. Here this images showing the different types of parasites in brain cirrhosis, that means GEAT. GEAT are, in case of northeastern region, GEATs are very common. Cirrhosis cerebris, GEATs also are common. And in case of GEAT, the frontal sinus bone, frontal bone is rarefication is there, softening due to constant pressure of the cirrhosis cerebris. So it is finally the main treatment is the surgical treatment. Likewise, nasal cystosomiasis, nasal sinus, ostrus obis in center in nasal septum. Thus, these parasites is very common. Lungworm, Dictyocollus viviparous, Dictyocollus phyllidi. Lungworms are the 4 to 10 centimeter long. This lungworm very dangerous because it's obstruct the alveoli, bronchioles, like that. And nowadays, Dictyocollus viviparous vaccine is also there. Nowadays developing. Irradiated L3 larvae, 1000 larvae we can administer in a younger age group of the animals for this lungworm infestation to prevent these diseases. Likewise, ectoparasite, we know the lice, mouse, lice, ticks, like that. So likewise in small intestine, Trichostrongylas, Coperia, Banostomum, these are the common parasites. A rumen is the Paramphestomasis, Abomasum, Himuncus, Controtus, and liver, fistula, like that. Injuries by parasite may suck blood. Himuncus is the, we have already discussed the Himuncosis or Himuncus controtus is the blood sucker. Or suck. Also, lice and fleas also suck the blood. May feed on solid tissues. That means liver flukes also damage the liver parenchyma, liver tissues. May sucks exudate lungworms. May obstruct absorb host food, tapeworm. May obstruct intestinal gallbladder, tapeworm. May obstruct bronchi, lungworm, like that. May destroy the host cell, coccidia. May cause allergic reactions. Many may transmit diseases, blue tongue, anaplasma. Some these diseases also transmit through some parasites, and many things. Many parasites produce the toxins also. Clinical symptoms: diarrhea, foul smelling, colic, grinding of the teeth, weight loss, poor basal consumption, body score points, and poor average daily gain also, itching, irritation. These are the common sneezings, nasal discharge, coughing, even abortion and anemia, bottles of sudden death. Different parasites shows the different symptoms. These are the common symptoms in a broader sense. See this the topic, the photographs. Here the first photograph, loose motions, mucus cells also coming from the, and these pale mucous membrane in case of hemoncosis, and fetid foul smelling, and this tapeworm also. See this fecal containing the tapeworm also. This botulism condition. These are the GI parasites common photographs. Fresh fecal test. Fresh fecal samples should be collected. Otherwise, larva will be developed due to this moisture, humidity and temperatures. Fecal egg count used only for the monitoring, not a disease. Egg EPG, egg per gram, less than 200, it is not harmful, but low to moderate, 200 to 500 moderate, and more than 500 is high. So in case of high EPG count, we have to use the anthelmintics medication. See the here the liver flux containing the liver. See the liver is fatty liver. This fat accumulation liver is there, and some this black cursor is there. This is the liver flow. This is the mature rumen flow, amphistomes. This is the immature rumen flux. This is the lungworm. I have told already. Dictyoclast filiary, Dictyoclast viviparus. These are the parasites, longest parasites, 4 to 10 centimeter long. And nowadays, lungworm we have to treat by the proper anthelmintics like ivermectin, like that. And the nowadays irradiated L3 larvae we can use as a vaccine for control the lungworm infestation. See, this is the abomasum from first left side, first slide. This is the Hemoncus, Barber pulse worms. It is very typical. We can easily diagnose this is the Hemoncus parasites. This is the Trichoris esophagostomum. This is the, see the cystodes. Cystodes generally block the obstruction of the intestine. It causes the death of the animals. This is the Ostrus ovis, nasal septum. The Ostrus ovis are found, and due to this, the animals used to cause the death. How to do effective deworming? We know the deworming is the main way to control the parasites. The selection of the choice dewormer and proper dose and proper drenching. Proper dose, we have to use the proper dose, and we have to drench the anthelmintics properly. Or time of drenching, empty stomach on early morning, we have to use the drenching. Selecting right dewormer. We have to use the proper anthelmintics. That means drug of choice. We should know the drug of choice. That means every drug is not effective for all parasites. I have told that for fasciolosis, drug of choice is triclabendazole, amphistomasis is oxychlorogenide, and GI nematodes, albendazole, fenbendazole, like that. These are the common commercially available parasitic anthelmintics. Deciding the correct dose, as I have told now, that we have to select the proper dose rate, and after calculating the proper weight, we have to use the proper dose to the animals. Underdose should not be there, because it leads to the development of the anthelmintic resistance. That means we have to be very cautious. Selection of the proper anthelmintics, proper dose. We have to avoid the underdose, overdose, and proper anthelmintics. And we should not frequently use the anthelmintics. When prior to deworming, we have to see the fecal examinations. After that, we have to use the anthelmintics. And these are the commonly available anthelmintics. This is the broad spectrum and narrow spectrum. We know the broad spectrum. Here I am showing albendazole, fenbendazole, oxfendazole, ivermectin, levamisole. These are the broad spectrum, and narrow spectrum is traclybendazole, praziquantel, niclosamide, clozentel, oxyclosanide, rifaxitinib, chlorsolone. These are the narrow spectrum. So we have to know the proper anthelmintic and proper to control the proper diseases. That means proper any anthelmintic parasitic diseases. That means if we use for control the hemoncosis, if we use the niclosamide, it will not work. If we use the to control the liver fasciolosis, if I use the albendazole, it will not work. So drug of choice is the main thing, and drug of dose rate, it should be very important. Here, this is the dose rate, broad spectrum. Here I am showing the albendazole in for mature parasite 10 milligram, and fenbendazole, oxfendazole, like that, and narrow spectrum. These are the niclosamides, clozentel, 10 to 15 milligram per kg body weight, oxychlorosanide 10 to 15, like that. So we have to the regular practice should be the proper anthelmintics and proper dosing should be there. Thank you.